are you?
I'm okay. How are you?
Yeah, right, not bad, thanks. Yeah.
Yeah?
Okay, yeah.
Okay.
Yeah. Well, I had my first CBT appointment for 8 months, I think, last week. So just sort of tweaked a few things that I was doing.
Okay.
So I'm just going to try and go to bed at 11 every night and cut out all alcohol, which I've been doing last week.
Mark has suffered with anxiety and depression since about 2012, 2013. He'd previously presented to his GP initially with just tiredness, but then he developed more depressive symptoms and was diagnosed with depression.
Also, I've been keeping like a sleep diary and activity diary. And, like a food and exercise journal as well. And just noting on it when I feel tired and how I feel, what thoughts are running through my head and that sort of thing.
Yeah.
Feeling a little bit better, but sort of mood sort of up and down still, which seems to be, I don't know, I thought I'd sort of, that had improved before, but it seems to still be sort of getting the sort of bit down and sort of suicidal thoughts and things.
How are you managing with the suicidal thoughts? What thoughts are going through your head?
Yeah, just feeling quite down and a bit dejected, I suppose, and just, just thoughts about ending it all and how I do it. But, I suppose they're quite occasional still. They're not that regular, but they're still quite sort of, it can last for an hour or two, sort of thing. I'm quite down and not really want to do anything.
Yeah, and that happens a couple of times a week? Or?
Yeah, it's not that regular. It's probably every other day, every few days, maybe something like that.
And what do you think about what you would do, or what your options are?
Yeah, that sometimes. Yeah.
And what have you thought your options are?
Just sort of running away or stabbing myself or something like that.
Okay.
Yeah.
You know what I'm like.
Yeah.
I will panic.
You're worried, you don't know.
And I'm worried, and I panic, and then I get depressed because I don't know what's going on.
Like, if I'm asleep, I quite often wake myself up thinking that I'm kind of choking a little bit.
You're not actually, when you wake up, you're okay.
It's fine, but it's kind of like a panicky kind of thing.
I was going to say, it sounds a bit like a panic attack.
I think you put a bit of weight on since I last saw you, haven't you? Yeah, you used to be a skinny chap.
I did. Well, it's all to do with my inactivity.
Oh dear.
Depression.
Oh dear, I'm sorry to hear that.
I've had a lot of stress over the last couple of weeks because it's the end of our financial year and we've all been scrabbling to try and do our numbers.
Yeah.
I think you're unwell at the moment, and I do genuinely think that you will get better.
Yeah, yeah.
I do have that hope.
Yeah.
That you are ill, and I think we are getting you on the right track, and I think all credit to you because you put so much effort into getting better.
Yeah, thank you.
As well,
Yeah.
And I think that you will have a fulfilling life again.
Yeah.
Mark is definitely someone who is doing his utmost to help himself, and when patients are really trying to help themselves, it does make our job much more easier, and they tend to respond better as well. Unfortunately, part of the problem with depression is that you sometimes lack that motivation and that drive.
Are you still seeing the psychiatrist?
Yes, but I haven't seen him for about a month.
Okay, so there's that to do. I know we've got to sort your medication.
I just need some more. But I don't know if I need a higher dosage on the sertraline.
In terms of safety, in terms of those suicidal thoughts, like if they get more common or you're taking them that bit further, then please let me know, let anyone here know.
Okay.
Go to A&E, because that's part of the illness, okay? And we won't want you to do anything when you're not, well.
Yes, sure.
That has such serious consequences.
Yeah. Okay.
Yeah. Should we put a review on?
Yeah.
Let's do 4 weeks, because you'll have seen the psychiatrist by then, and
yes,
it'd be nice to know how the chronic fatigue referral is going through.
Yes, sure.
Okay? All right.
Thanks so much.